My name is Steve Krouse. I am doing AC joint sprains. The AC joint is a synovial joint, like Dave mentioned, located between the acromion and the clavicle. Stability of the AC joint is provided horizontally by the AC ligament and superiorly by the CC ligament or coraconavicular ligament. A sprain occurs usually with an acute blow, which causes laxity in the joint, or in extreme cases will cause dislocation or displacement. Most common reason athletes seek medical attention following an injury is due to an AC sprain. Rugby, wrestling, and hockey have the highest exposure rates. And also associated clavicle fracture is possible with an AC sprain for the more intense hits. And males are 5 times more likely than females, which makes sense because males typically are in more contact sports than females, football, and even the contact sports females are in, there usually aren't as many hits. They're graded into 6 different grades for AC sprains. So the first grade would be just partial damage to the AC ligament, so this would be the athlete having pain. There's really no laxity or deformity with this grade. Grade 2 would be a rupture of the AC ligament, and usually a sprain of the CC ligament. So you'll notice slight laxity and possible deformity with this one. Grade 3 would be a complete tear of the AC and CC ligaments, and with the complete tear there's going to be visible dislocation or deformity of the clavicle from the acromion. Grade 4 is complete tear of both, and also a tear of the deltoid and trapezius fascia, along with posterior clavicle displacement. Grade 5 is the same as grade 4, but the displacement of the clavicle is 1 to 3 times the height as the uninvolved limb. So if you compare them bilaterally, you'll see that one clavicle is sticking out 1 to 3 more times the height than the other one. And then grade 6, the most serious, is where the clavicle is displaced inferior underneath the coracoid. So as Dave mentioned, the mechanism of injury is a fouche, so falling out on an outstretched elbow, and causes the scapula to be driven posterior to the clavicle. You can also take a blow to the superior acromion, which would force this scapula inferior to the clavicle. And also any force that would drive the clavicle away would also cause it. And it also, the AC joint can be strained. This would be more for grade 1 or 2 with overuse. So some signs and symptoms: you're going to have obviously pain over the AC joint. And if it's a higher grade, you're going to have noticeable displacement of the clavicle. And with pain, when doing your testing, you're going to have pain with elevation during protraction and retraction. So if you protract and do elevation, they're going to have pain. And also decreased strength for all muscles attaching to the acromion or clavicle. So the upper trap, pec major, probably going to have decreased strength if you have an AC sprain. In terms of the treatment, there's a lot of debate with this in the articles that I read. Most of them agree that with grades 1 or 2 to take a conservative approach. And with all of them, you want to immobilize first to get rid of the pain first with icing and immobilization. And then treat. You can use a corticoid injection, which will provide short-term relief, but it won't necessarily help with the long-term effects. And for grades 3 through 6, you have the option of surgical, and this is where the most debate is, because with surgical, any repositioning of the clavicle can cause more problems long term. So a lot more people choose to go with the conservative approach, so increasing range of motion, strength, and just working them back into play that way, rather than taking the surgical approach. For on-site evaluation, you're first going to want to do a primary survey. And this is especially important if you have a higher grade, because if they have a dislocation, you want to make sure that you're monitoring for shock, because if they look down and they see that their clavicle is not where it's supposed to be, there's the likelihood that they'll go into shock. And also just make sure, if they're usually with an acute blow, there could be other injuries, specifically because of the brachial plexus right there. So you want to make sure you do all your neurological tests and all that as well. And then for secondary survey, you want to do inspection, palpation of the clavicle and scapula, test all your ranges of motion, and manual muscle tests, so specifically upper traps. And also there are 2 special tests, are the AC traction and AC compression social tests, which would both be positive for an AC joint sprain.